and social well-being. And so that health is much more than just treating something that's broken. So now what happens with this system, or how does the body then become unhealthy? Well, at some point, something stresses our body. And when it stresses our body, it causes an interference to this original function, the function that we were born with. And they called it stagnation. Now, a good example of a stagnation is you trip off a curb and you twist your ankle and that area gets inflamed and blows up and swells up. That would be a local stagnation. But you'd be surprised to know that actually stagnation can happen anywhere in the body. And when that stagnation happens, whether it be to a joint, whether it be to an organ, whether it be the tissues, whether it be to the brain, is that your function is going to go down. And when your function goes down, the body then becomes imbalanced. And when your body loses balance, the disease process starts. And then you lose your health. Now, you'll notice something in here, and that is that I haven't mentioned anything about symptoms. The reason for that is because the disease process is usually something that occurs over time, and most people don't know it until you're at the later stage, usually below 30% function. We know that Western tests don't trigger a positive result until you're really at that later stage. The example is the stress test that you do to check if your heart's healthy. Well, the stress test will not trigger until you have a 70% blockage. So I always ask all my patients, so how healthy are you at 50%? The answer to that usually is no. In fact, I had one patient say, I'm half dead. And so we know that many of the diseases that we deal with today are things that happen over time. Breast cancer takes 10 years. The Mayo Clinic just recognized that pancreatic cancer, which is one of the most ravaging cancers, actually takes 20 years to grow. And we know that the 3 leading causes of death in our country are lifestyle diseases that evolved over time. Honestly, if you went to eat at McDonald's, you're not going to drop dead of a heart attack. But if you eat at McDonald's every day, over a period of 10 or 20 years, you're probably going to have a problem. You're going to have a stagnation that's going to lead to the symptom of maybe a heart attack. So the ancient early doctors understood that treating the symptoms at the bottom here, at the bottom of this long train is the symptoms. And the early doctors knew that if you treat just the symptoms and don't correct the root, then you're not really getting the body healthy. And that's the critical, important process that I like everybody to know when you're dealing with alternative medicine. To prevent disease, you have to restore function. Now, we have some terms for this. When you're just dealing with the symptoms, whether it be fatigue, whether it be hormone problems, whether it be pain, and you're not addressing the underlying cause, what you're really doing is you're doing something we call symptom relief. Now, symptom relief is very temporary. The example of this is if you have hypertension or high blood pressure and you take a drug, it's going to bring your blood pressure down. But what happens when you stop taking that drug? Your blood pressure is going to go right up. That's because you're treating the symptom. It's like if you have a headache and you take an aspirin and it's chronic headaches, as soon as you stop taking the aspirin, the headache's going to come back. That's symptom relief. Now, the emperors of China didn't want to relieve symptoms. They wanted to stay healthy, so they demanded that their doctors did something called corrective care. And corrective care is where you're, in our medicine, is where you're dealing with the underlying imbalance, a blockage in one of the systems of the blood, the nervous system, the organs, or blood flow and oxygen flow, and you're restoring that function, and then you're restoring function to the body. So now the function goes back up to 100%. You remove the imbalance, and you stop the disease process, and you restore the body back to health. And the takeaway from this is 2 things. Number 1 is, if you want to live like the emperors of China, you want to have corrective care. If you want to live a long, healthy, vital life, then you want to correct the problems before you have symptoms. Because symptoms are a way of the body telling you that something's wrong. But symptoms only happen at the end. If you just want a patch job, then we treat symptoms. The important part, many people think that preventative medicine is expensive, but I'm here to tell you that treating the symptoms over and over again is the most expensive way for you to stay healthy, as opposed to correcting the underlying problem. That's why the United States is rated 48 out of 49 out of quality of health care, and yet it's the most expensive health care in the world, because our doctors who are fixing us, who are experts at dealing with infection and trauma, they're dealing with the symptoms. And when they deal with the symptoms, they're not correcting the underlying problem. So while they're experts at dealing with emergencies, when it has to do with chronic dysfunction, if you just treat the symptoms, you continue to treat them over and over again, and it's much more costly. As opposed to corrective care, which when you correct the underlying problem, the body balances out, and then all you do is maintain it. In the same way that if you had a cavity, you would get the cavity fixed, and you would continue to brush your teeth to maintain good dental health. So I wanted to share that with you tonight so that you understand that alternative medicine is the best way for you to stay vital and healthy and to prevent disease by correcting the underlying problem. Thank you, and I wish you good health.